During the COVID-19 pandemic, emergency rooms say they've seen an increase in children visiting with mental health struggles. In fact, 1 in 5 children today are battling a significant mental disorder, yet less than half receive the support they need. To help young people and their families battling this mental health crisis, Children's Hospital has kicked off a challenge called the High Five Challenge. Dr. Megan Campbell, LSU Health child psychiatrist at Children's Hospital New Orleans, joins us this morning with what families need to know. Hi, Dr. Campbell. Good morning.
Hi, good morning. Thank you for having me.
Thank you for joining us. So first, why do you think it is that so many children right now are struggling with mental health disorders? Is it the pandemic, the lockdowns, being out of school, just them being thrown completely out of their routines?
We choose all of the above. I think that we're all experiencing so much stress, in addition to everything kids are going through, which is huge, and their complete lack of normal outlets that you would expect and want a teenager to have. Yeah. Families and parents are under stress, and that brings stress to everyone in the family.
Absolutely. Do you find that a lot of times parents may not have any idea that their child is having a problem until, they talk to a doctor or they talk to another mental health professional? It's kind of hidden at times.
Unfortunately, that's a really common experience we see a lot of, is parents feeling very surprised by how their teenagers have been feeling.
Because they're very good, I guess, at masking their feelings.
Teenagers are famously aloof creatures, and I think it's a very normal thing for teenagers to separate a little bit from their parents. And so parents often identify this decrease in communication with the teenage years. And
Sure.
So trying to figure out, well, is my teenager actually going through something more can be a challenge.
All right, so talk to us a little bit about this High Five Challenge that Children's Hospital is putting on.
Sure. Children's Hospital of New Orleans is growing, and we've opened and grown to open a 51-bed facility. And our High Five Challenge is a campaign of mental health awareness that we started in 2020. And what we're doing is we're seeking to increase awareness for this big need. And the High Five Challenge has different aspects. This current aspect is to try and encourage parents and teenagers to have at least 5 minutes of real talk every day where they discuss stressors and coping skills.
So what if you sit your teenager down and say, all right, we're going to have a 5-minute chat here, and your teenager just doesn't want to open up to you?
I think that's a common experience too, but opening that door and establishing, hey, I'm here for you, I want to know what's going on with you, so that your teenager knows that you're accessible, that you want to know, that you're there for them when things are going on.
On the Children's Hospital website, as part of this High Five Challenge, are there resources for parents to kind of guide them on how best to speak to their teenagers, how to get them to open up and to, tell them what's really going on in their lives?
There sure are. We have some links to some, I believe it's chinola.org/high5.
Okay.
And there are links and videos and suggestions to ways to talk to your teenager or things you can do when your teenager is expressing that they're not feeling well.
Well, it's definitely an area that needs a lot of attention right now. Dr. Campbell, thank you again for joining us this morning.
Have a good day. Thank you.
Thank you.